And moving on, after breast cancer, a husband and wife share their firsthand account of dealing with reconstructive surgery.
Serving all of San Diego, this is your Fox 5 News.
We continue to recognize Breast Cancer Awareness Month this morning with board-certified plastic surgeon Dr. Vincent Marin. Also joining us this morning, we have Shannon and Jerry Almada to share their personal story. Good morning to everybody. We appreciate it. Shannon, let's start first with you. Tell us a little bit about your story. You were diagnosed with breast cancer in 2007. Tell us about that.
2004.
2004.
I was 31 years old, and just one morning, kind of fluky, I did a self-exam. It wasn't something that I did regularly. I don't think a lot of people do at that age, but I did it. And he actually came home from work that morning. He's a fireman. So he came home, and I'm like, do you feel that? And it ended up being stage 2. It was already in the lymph nodes, and within a month we had started chemo.
And you went ahead and decided to do the double mastectomy.
At the end of the treatment with the chemo, I was due to start radiation, but I just opted to go ahead and have them both removed and hopefully never deal with it ever again.
And you opted to wait to do the reconstruction because you wanted to have another child?
Yeah, I was on medicine, some oral medicine, and that took a while to be able to get my doctors to let me get off that, kind of get things going again and get pregnant. And so Noah was 6 months old when we started the reconstruction process.
Excellent. And Jerry, tell me, if you would, how this sort of affected your relationship. I mean, you don't, no one expects this to happen to them, and especially at a young age. You were 31?
Mm-hmm. Exactly. I mean, you don't expect to go through something like that at that age. I mean, and being ill-prepared, I could say we probably were, but you know, you just come to a point where you just got to deal with it, and that's what we did. And it really kind of brought out what was strong about our relationship, honestly. And through the whole thing, I mean, we even to this day say that these circumstances have brought us together and made our relationship a lot stronger.
What was the biggest challenge for you all dealing with this as a couple?
Oh, I just think that year when I was so sick was the worst. I mean, being sick with the chemo and having to go through chemo every 3 weeks, and then being sick, vomiting for 5 days in a row. Since he is a fireman, he was able to give me the IVs at home, which was really helpful, just to get me hydrated again. But that whole year just really stunk.
Yeah,
it did.
I can imagine. And Dr. Marin, let's bring you into all of this. Let's talk some numbers here about reconstruction. Do most women opt to get the reconstruction done after they've had it?
It's the biggest issue we have with this is a lot of women don't even know. We have about 70% of women don't even know that they have reconstruction as an option, and it's actually mandated by the federal government to be paid by insurance. So 70% of women have no idea that they even have this option to go on and kind of almost close that chapter in their life. So it's amazing how few people realize.
That's incredible.
Yeah.
Why is that? Why do you think so few know?
It's hard. I don't know. There's been so much push behind breast cancer awareness, which I think is obviously priority #1 is the diagnosis, but then we're starting to realize that maybe women just wanted to be done with it, and not every woman is interested in more surgery as Shannon was, you know, and saying that, you know, I just need a break. But in finding this out, I think it's been a huge public awareness campaign, not just breast cancer, but now breast reconstruction, to help women realize that, one, they have the option, and two, it's covered.
So let's go through a couple of the options right now. First of all, tissue expander and implant-based reconstruction. Tell me about this.
So what happens is when they do a mastectomy, they take away a lot of the breast skin. We're trying to preserve, let's say, the nipple or areola now, and there's other options, but what happens, there's not enough skin. You have to slowly expand that skin with an expander. Shannon been through that, where you come in, they put a needle through the skin, put more fluid in to slowly stretch that skin until it's ready to accept an implant. Second procedure, take the expander out, a soft silicone implant will go in its place.
Another option is the implant and using your muscles?
Right, so there's skin and muscle on the back that can actually be transferred across to the front, so you don't have to go through as much of the expansion. You bring in more skin and healthy muscle to help cover a new implant. The reason we do some of that is a lot of patients, unlike Shannon, may go through radiation that will damage that tissue, so we want to bring in new healthy tissue to help cover that implant.
Another option is using actually your abdominal muscles?
So another option we have is we take the skin and fat just like we would for a tummy tuck, but we keep it connected to its blood vessels. You tunnel it up reconstruct a breast in the same way. So it's another way, and the women like that because they get the benefit of a tummy tuck.
I bet,
So
yeah.
that's a good
And
thing.
that's different than fat grafting, which
Fat
is
grafting is one of the newest things that we're seeing, is that we're actually taking fat as much as we do in a liposuction procedure. So there's another kind of accessory benefit to that. Take that fat, re-inject it into the breast. We can rebuild a breast that way. It's usually done over stages, but again, same type of thing. You put that underneath the skin. It'll help recreate a breast, and we'd be surprised at how beautiful the results can be. Some people can't even tell that it's ever been a reconstructed breast at all.
And then looking ahead to the use of stem cells.
Yeah, so stem cells is what we're seeing with fat, is trying to almost grow this tissue maybe outside the body, and then later date re-implant this as your own breast. It's your own tissue, and that's kind of the future, not quite out there yet.
Real quickly, is one better? One of these options best?
Everybody's different, and you have to individualize. So they're all great options. All women should try to look into this, and we really just want people to know that it's an option for them, and most insurance, if not all insurance companies, will cover this.
That's awesome.
Yeah.
Shannon, how are you doing now?
I'm doing great.
Yeah?
Yes, healthy kids, and everything, all my checks every year have been fine.
Good. And Jerry, if you could give a piece of advice to anybody out there that's watching this that maybe is newly diagnosed, or a husband not quite sure how to deal or support his wife.
Well, first of all, don't take your self-examinations lightly. If you do think you have something, follow through with it, because we went through a process where people were telling her step by step that it was nothing until we followed through all the way through.
The doctors were stunned. I got phone calls at home saying, you know, wow, we didn't think it was going to be this.
Definitely follow through and support, you know. Make sure you support. People don't realize the power of just a little support, whether it's your neighbor, your wife, your family members.
A little encouragement goes a long way. Thank you all for being here. We really appreciate it. Thank you for sharing your personal story with us this morning. And to get in touch with Dr. Vince Marin at Marin Aesthetics in Del Mar, the phone number's up on your screen. We've also linked the information on our website, Seen on Tab. Just go to fox5sandiego.com and click on that Seen on Tab. Mr. Martinez, really, really important stuff this morning.
Yes, great information. Erica, thank you.